Okay, so what is HACOR score? So whenever you face a patient where you want to give an NIV trial, maybe of any disease, COPD, ILD, pneumonia, anything, pulmonary edema, anything, you want to give NIV trial or BiPAP trial to this patient and want to predict whether this my patient will succeed or NIV trial will succeed this patient, or this patient may get intubated and this NIV trial will not be successful. So this is where HACOR score becomes useful. So you start an NIV trial, and at the end of the 1 hour, you calculate the HACOR score. So it is up to 25. So if it is more than 5 at the end of the 1 hour of your trial, there are more than 85% chances that your NIV trial will fail and this patient will get benefited more from early intubation. So how it is calculated? So 5 things you need to see: heart rate, H for heart rate, A for acidosis, C for conscious level, O for oxygenation, and R for respiratory rate. So these 5 things you need to calculate. It's a very simple score. You can use the table or the app in your phone. So we were discussing this in our mentorship forum group, ESBICM mentorship forum group, which is available at no cost for all the critical care trainees. You can get and go and apply on esbicm.org at no cost. So when we were discussing this, one of the important things other than predictability and all those things, one of the candidates, one of the members told us, and it was very nice, that he said that when we calculate HACOR score, it becomes very easy, or it becomes very useful when we have a multidisciplinary team meeting or when we have a discussion on the rounds. It is becomes very objective assessment that the chances of failure of an IV failure in these patients were high or low. And also, second important point, that if your HACOR score is high, that doesn't mean you need to immediately intubate the patients. It means that the chances of an IV failure are high in this patient. You need to think of early intubation to this patient, or if you are continuing with the NIV trial, be very cautious, be very vigilant for this patient, because the chances of failure are very high in this particular patient. So this is how HACOR score is used, and do read more about it. Thank you.